Okay, so next we're gonna inspect the abdomen. Always maintaining privacy. So, you're gonna pretend to divide the abdomen into 4 quadrants from the umbilicus, or the belly button. Imaginary lines. So for the abdominal assessment, you always want to inspect first. You never want to start palpating because you can move around the stomach, and when you auscultate, you'll hear noises that maybe weren't initially there. So you're going to inspect first, make sure there's no masses, make sure there's more normal movement of the stomach from breathing, and then you're going to auscultate, and you're going to start in the right lower quadrant first. This is the most active quadrant. And then you go to the right upper, then the left upper, and the left lower. And you should be listening in each quadrant until you start hearing bowel sounds. And if you don't hear bowel sounds after 5 minutes, listening about 1.5 minutes in each quadrant, then you always notify your doctor. That is usually a bad sign. Okay, when you also are inspecting the abdomen, you want to ask them if they've had any changes in bowel habits lately, any nausea, vomiting, diarrhea. Ask them when their last bowel movement was, and ask if any changes in their urinary system, which is what we'll get into next. So maybe they had some frequency, some urgency, some burning on urination. You want to make sure you're asking all these questions. And if it's a female, you want to ask when their last menstrual period was. So when you're inspecting the urinary system, you don't want to palpate, you don't want to be able to feel the bladder. It's right above the pubic bone. You don't want to be able to feel the bladder. That means it's full and they're having urinary retention. And in that case, if it's available to you, you would get what is called a Doppler. It's like an ultrasound, and it will estimate the amount of urine in the bladder. Okay. And when you're doing the genital assessment, it's just inspection, and you're just gonna check the hair, see if there's even distribution, there's no lesions, no rashes, no abnormal discharge in females, make sure there's scrotum is symmetrical in males, and just that there's no rashes or redness or anything. Okay, next we're gonna do the rectal exam, and we're gonna have to turn the patient on their side. And I'm gonna have Michelle come and help me.
I'm actually going to pull this side around. It's easier for me. This side? Not gonna come this way. Good.
Okay.
Just enough to so you can see what you need to do.
So you're gonna want them in like a lateral position, and you're just inspecting, and you're just gonna check for hemorrhoids, redness, any tenderness, if they have any lesions, and it's just an inspection. And while we're here, I also just wanna talk about posterior breath sounds when you do your respiratory assessment. So you're gonna wanna listen in the same regions, just on the back. Bronchial up here by the neck. Bronchiovesicular a little lower, the upper mid back. And then vesicular, you're gonna be in the lower back and on the sides. Okay, I'm gonna bring them on the back.
Good job.
There we go. Okay, so next we're just gonna inspect the legs. So as always, you're doing everything on each side. I'm just gonna demonstrate on this side. So tattoos, swelling, rashes, redness, if they have edema, swelling, just wanna make note of it. If it's only on one side, or if it's worse on one side than the other. And range of motion, have them bend their knee, have them lift their leg, wiggle their toes. As you can see, these toes have necrosis, which is why it's black and it has some surrounding redness. But you're also checking, same as the nails, clubbing, Capillary refill should be less than 3 seconds. And then I like to ask the patients to push down on both my feet like a gas pedal to test the strength. And then you're also gonna check sensation just through light touch. You wanna make sure that they can feel everything equally on each side. And also you wanna check the pulses. So the femoral pulse up here, the popliteal pulse back here, the posterior tibial pulse, and the dorsalis pedis pulse. And you always want to make sure those are symmetrical and equal. And then the last thing that I would assess is I would have the patient stand up, and I'd assess their gait, their posture, their balance, make sure they have good coordination. And that is a full head to toe exam.
Would you like to check tactile firmness?
Yes, that is also important. Part of the respiratory assessment.
Excuse me?
Okay, so when you're doing tactile fremitus, you want to put your hands where the bottom of the rib cage would be and press good, so press in pretty hard so you can feel. Don't be shy. And you're going to ask the patient to say 99.
99.
Say it again.
99.
And again.
99.
And you just want to make sure you can feel those vibrations that are made from your chest. And
So you can go into the upper lobes also, so each section. All right. 99.
yeah,
99.
yeah, you can feel the vibrations.
99. Okay, what about excursion? Would you want to do that?
Excursion, you want to make sure that also same position when they're taking breaths that you can feel the rise and fall equally because your chest expands. Perfect. Okay. All right, so yeah, you just want to make sure that you're always maintaining privacy with the patient, that you're asking questions through each body part, if they have any history of cardiovascular disease, any change to their bowels, any change to the urination, and just always making sure you have your gloves, your hand hygiene before, and always do your 2 identifiers. And part of your health assessment, you'll probably start off with the vital signs, a full set of vital signs.